Good evening, our dear viewers. Once again, you're welcome to our health talk show. And my name again is Dr. Kansime Grace. I am a kidney specialist, a physician, kidney specialist here at Mara Regional Referral Hospital and a lecturer at Mara University of Science and Technology. We thank you very much for watching our last show, and this is the second part of the show like we promised you. So you're very welcome, and I'm here once again with my colleague, Dr. Rose.
Good evening, viewers. Good evening to whoever else is interested. Thank you very much, Dr. Kansime, for that introduction. My name is Dr. Rose Mugambo. I am a kidney specialist, physician, head of internal medicine, working as a senior lecturer with Mara University of Science and Technology, and also with Mara Regional Referral Hospital. Thank you very much for joining us this evening for the second part of our show. Over to you, Doctor, please.
All right. So for those of you that gave us calls after the first show, thank you very much. And feel free to get in touch or to come to hospital or to post your questions in the chat. We shall be responding to those. And so for today, as you know, for those of you who may not know, you can go back, maybe catch our last show. So the last show we talked about the kidneys in general, and we were talking to you about what our kidney is as part of our organs that basically filter our blood and keep it clean, remove the waste products, but also there are other many functions that we talked about. So for today's show, we are going to talk about kidney disease. So as we talked about in the last show, what kidneys are and what their functions are, when we talk about kidney disease, or when kidneys are not working as they should and not doing those functions, what happens to your body? And if unfortunately that happens, where can you find treatment? Where can you seek help? So that's what we are talking about today. And so to start us off, when we say that you have kidney disease, I know when we are out there and someone says you have kidney disease, sometimes it feels like a death sentence, but it shouldn't feel like that because there is help. And this is what we are discussing today. So when we say that you have kidney disease, literally it means that your kidneys are not working well as they should. They are not doing their job as they should. So if the kidneys are supposed to filter, and for those of us who are here maybe for the first time, you'll keep hearing us saying kidneys because we ideally have two kidneys, like we said, and most times, unfortunately, when you have kidney disease, both have been affected. So that's why you keep hearing us saying kidneys, other than maybe if it was the heart, you'd just say the heart because each person has one heart, but most times each person has two kidneys. So when our kidneys fail, or when the kidneys are sick, when you have kidney disease, it means that your kidneys are not doing their job of filtering blood very well. And so there are some things you will experience as a person or as a patient, and we are also going to talk about the common causes. But before we talk about causes, let's first talk about kidney disease in general. So there are two types of kidney disease. There are very many types, but we group them into two major types, what we call acute and chronic, and I'm going to explain this a bit. So acute is something that has happened suddenly, and chronic is something that has been there over some time. So meaning that your kidneys have fallen sick or have gotten damage over time, and this is usually a period of more than 3 months. So it can be months, it can be years, it can be so that we say it is chronic. When it is acute, it means it has occurred suddenly, and that is within a few weeks or up to a maximum of 3 months. So I'm going to give us examples. So let's say I am walking, crossing the road, coming maybe in the hospital to work like today morning, and God forbid a border knocks me or a car knocks me, and maybe I break my leg, I get a fracture, and then I bleed, so I lose a lot of blood. So because my kidneys are losing a lot, because my body loses a lot of blood, my kidneys do not get enough blood at that material time, and so they go, let's say, into shock, and we say the kidneys have been injured. So that is something that has happened suddenly, so that is acute. Let's say a child suffers from malaria, and because of the severe malaria infection, they get their kidneys damaged. Or a child has diarrhea and vomiting, or even an adult, diarrhea and vomiting, and you're losing a lot of water in vomit, you're losing a lot of water in the diarrhea, and so the body volume is not enough and your kidney does not get enough. So all those things are happening within a day, within hours, within weeks, and so that is an acute kidney disease or acute kidney injury. So the chronic, let's say someone has high blood pressure or someone has diabetes, and over time this high sugar or the high blood pressure is affecting the blood vessels that are supplying the kidneys. All the sieve, the cajejena that we talked about last time, because that sieve is made of blood vessels. So if those blood vessels that go to the kidneys or are within the kidneys are getting damaged over time, because you'll hear someone has been having high blood pressure for 10 years, someone has had diabetes for 20 years. So over that period of 20 years, the kidney is affected slowly. So eventually when they get kidney disease, most times it will be chronic kidney disease. So that is really, those are the two big types, and the reason why we emphasize those is because their treatment may be the same, but the treatment outcomes are really totally different, as we shall discuss. So now Dr. Rose is going to take us through, as you've had me hinting about the causes of kidney disease, Dr. Rose is going to take us through the causes of kidney disease.
Okay. Thank you very much, Dr. Kansime, for that brief overview. And as she said, I'm going to try and take us through the causes. She was trying to categorize. We talk about acute and chronic. Now, for us as kidney specialists, when we're thinking about causes, we like to look at the kidney. So if you remember, maybe I can inform us that the kidney is a bean-shaped structure, and it has blood vessels that come into the kidney and also blood vessels that go out of the kidney. Okay, then it also has small tubes that we call ureters that now take the urine. Okay, so when we're thinking about the causes, we would like to talk about causes, that things that affect maybe the blood supply. Okay, and we typically say pre-renal causes. Renal is another word for kidney. So pre-renal causes. Then we also think about things that affect the kidney itself, and those are the renal causes or the kidney causes. And then things that are going to also affect the outflow of urine, so we call those post-renal causes or post-kidney causes. So the pre-renal causes, Dr. Kansime has highlighted some. You're thinking about things that are going to affect the flow of blood, the perfusion of blood or the supply of blood to the kidneys, how much fluid is getting there, how much blood is getting there. So the pre-renal causes will be things that really affect how much is getting in. As she said, if you get severe trauma, you bleed a lot, then you're going to have very reduced levels of blood volume. So you can imagine what's reaching the kidneys is not enough. Okay, if you have diarrhea and vomiting, again, you will get dehydration. So the amount of water that is getting to your kidneys is also not enough. If you're dehydrated from maybe in severe heat circumstances, you've had people that live in very hot and dry environments, they'll get dehydrated in one way or another. You can also get reduced blood flow or supply to the kidneys, even when you have a bad infection like sepsis, and that will also give you a pre-renal cause. The other pre-renal causes also is that if you have had some of the vessels now that bring blood to the kidneys themselves may be being narrowed from another disease, that will also affect the supply of the blood to the kidneys. Now within the kidneys itself, the renal causes that we can think about. Now there are several, but Dr. Kansime had highlighted things that affect the sieve that we tried to emphasize in our previous session. Any disease that affects the sieve, and these are many. This can be diabetes, this can be hypertension, this can be HIV, this can also be many other causes that will affect that sieve, would include even hepatitis B, hepatitis C, syphilis, some medications that we use also for treatment of various diseases. So those things can damage the kidney inside or within the kidney itself. If you've had a big crush injury or you have had prolonged seizures, you're going to break down your muscles. The muscles are made up of a special protein that we call myoglobin that will come out, okay? And it's very big. It cannot be filtered by the kidneys. So it tends to damage that, the sieve or the tubules, as we say, because the kidneys within themselves also have very small structures that are responsible for their filtration. The other causes of intrarenal causes, I think those are probably like a big category. Now, thinking about the post-renal causes, so you want to think about the kidneys as a conduit, like something that needs a continuous flow. You do not need anything obstructing. So if the blood is coming, we need it to come in the required quantity. If it's getting into the kidneys, we need that also to be there, okay? Now, as the urine has been formed, or as the filtrate has been formed, now it also needs to get out. So if you have anything that is obstructing that flow of urine, it's also going to, even if it can eventually cause kidney failure. So the common causes of obstruction, I'll start with the commonest is really like prostates for men who are older than 50 years of age. The prostate sits right under the bladder, so it tends to expand as they age, and if that has been going on for a long time, then the flow of urine is actually impaired. You can also have obstruction from a kidney stone. Now, I need to say that we have two kidneys. This is a reminder. So you will have two ureters. So you'll have two drainage facilities, if I can say. Now, for you to get kidney failure that is recognizable, you need to obstruct both sides, okay? And this is where the kidneys are clever. If you obstruct just one side, you may not really know. As long as the other kidney is working very well, it will keep trying to do what it has to do. It takes over for its friend, if I can say, for its colleague. But if you obstruct both sides, okay, then you will affect the function of the kidneys. And that is why the prostate sits down at the lower end, at the urethra. So that's able to obstruct both sides automatically. But things like stones, you can have a kidney stone that is lodged into the ureter, probably on one side. Unfortunately, if you have on both sides, that's a different story. So a stone can lodge itself there and also cause obstruction of that kidney. You can also have masses or tumors pushing from the outside. So those will also cause, from the outside of the ureter, those will also cause obstruction. In the beginning of our talk, we had said that the kidneys are, medically, we say retroperitoneal organs. They are behind. So we do have diseases that will cause scarring of that area that is behind where the kidneys lie, which we typically call retroperitoneal fibrosis. So that can also cause obstruction to the flow of urine. You can also have, what else can cause post? Yeah, so even women who have any gynecological or pelvic, not even women alone, any pelvic tumor can also obstruct the flow of urine. Commonly for ladies, it's going to be maybe cancer of the cervix, remembering that this needs to happen on both ends. So as soon as the urine is not able to get out, then it starts to accumulate. It will, you can think about it, say maybe there is a backward flow, so you're putting pressure on your kidneys, and yet they are still trying to make as much urine as they can. So that eventually leads to poor functioning of the kidneys. The other post-obstructive, post-renal cause can be urethral strictures. So the anatomy of the kidneys typically starts with the kidneys, we've said, then you have the two tubes that are coming down, that's the ureters. They will end up in the bladder, that one big hole, and then after the bladder you then have the final tube that now puts the urine on the outside, and that's what we call the urethra. So the urethra can be fibrosed or scarred, and that's what we call a stricture. That happens normally if people have had like sexually transmitted infections that have tried to heal, or maybe they had a urethral injury that healed with a scar. I think that might be as much as I can think of. The causes are many, but that's probably a brief overview.
Very true. Thank you very much, Dr. Muhindo, for that comprehensive overview of the causes. I'm just going to highlight a special category, people that are dear to me, the women. So the women in a special way are predisposed to kidney disease, especially the acute type. And this comes because of what women do, pregnancy and delivery. So pregnancy is a fantastic period, and bringing a baby into the world is fantastic, as you all know. It makes people mothers and fathers and grandmothers, but there are complications that can come along. So pregnancy, especially as it is, a lot of things happen, and some of those things may affect the kidney, but more especially surrounding kidney birth. So during pregnancy, some women unfortunately develop high blood pressure, high blood pressure that is associated with pregnancy, and that can affect the kidneys, but more so around the time of birth. So several things can happen if someone has had that high blood pressure, or if someone bleeds a lot for one reason or another. There are very many things that can cause excessive bleeding. Remember, if you lose a lot of blood, the kidneys don't get enough, they shut down. So if the mother bleeds a lot, if they get infections surrounding delivery or post-delivery, like you had infections, are causes of kidney disease. So we usually really look out, especially for mothers, because they can get kidney disease from those things, from those usually normal physiological things that happen. So when you're pregnant, that's why you see they keep telling them go to for antenatal, and at every antenatal they are checking your blood pressure, but they are also checking your urine. So don't say, why are these people always checking my urine? That is why they want to make sure that your urine is okay, which means that your kidneys are sieving very well, there isn't anything that shouldn't be there. So mothers, in a special way, make sure during pregnancy you're having your pressures done, and when you go for your antenatal, you're having your urine tests done. Good. And then there are children. Children are another special category that can get acute kidney injury, especially from infections. As we know, almost for all of us parents, our kids one day or another, they have had an infection, and it could have been as light as the coughs and the flus that are going by, and maybe they are walking to school with those, but it could get worse. So children can have severe malaria, children can have pneumonia, and this can get really bad. Sometimes children also can get urinary tract infections. So any infection that they can get, children are the ones that really get lots of meningitis, bacterial meningitis. So any severe infection can get children to have acute kidney injury. And sometimes these come with severe anemia, and of course when the blood goes down, then the kidneys are not getting enough. So I guess by now, from the way we've described the causes, you know that no one is spared. Unfortunately, no one is spared when it comes to kidney disease. So if you're young, don't be there and you say, okay, for me, I think kidney disease is for my father and mother, the elderly. I will not get kidney disease. That's not true. So kidney disease children can get kidney disease. Teenagers can get kidney disease. So another thing that can cause kidney disease is if you maybe got an accident and your kidney got injured. So as you play football, as you run around, you may fall, you may get an accident. So teenagers can get kidney disease, young adults can get kidney disease, and so are the elderly. So really those are the causes of kidney disease.
I could add just a few more, as I remember. There are quite many, but the kidneys might also suffer as a result of other existing conditions, so not necessarily because they were the start point. So your heart, you can have heart failure, meaning that your heart is not able to pump out enough blood to supply the rest of the organs. The kidneys typically need between 20 and 25% of whatever comes out of the heart's volume at any one squeeze. So if you have heart failure, it means your heart is not pumping out enough. The kidneys are going to suffer because they are just not receiving enough blood. Okay, you can also get kidney failure because your liver is sick. So you might have acute or chronic liver disease, and then eventually, either acutely or slowly, your kidneys also could suffer as a result of that. Thank you.
Okay, so now that we know what causes kidney disease, if you actually happen to have kidney disease, what are the signs and symptoms? Just like when we are out there and you get flu, you say, oh, I have flu. Maybe these days it's COVID that has been going on. So when you get flu, you don't feel fine. You're like, oh my God, do I have COVID? Or traditionally, when you have headache and you're feeling feverish and maybe you're not eating well or actually vomiting, you'd say, I think I have malaria, let me go to hospital and check. So what are these symptoms? What are these things that when you feel them or when you see them, you say, oh, I think I may have kidney disease. So as you can imagine, we talked about the function. So it means that if your kidneys are not working well, they are not doing those things well. So for example, kidneys are supposed to filter blood and put out the excess water. So if you're, maybe before I start you onto the list of those things to look out for, I want to say that, and I really would wish everyone to get this, I want to say that by the time, unfortunately, by the time you see these things, almost 70% of your kidneys is gone, is not working. So that is the very, so kidney disease is a silent killer. That's what we call it. By the time you get to know that I have kidney disease from these things that we are going to mention, it means that at least 70% of your kidney function is gone, is dead. So if your kidneys are supposed to work at 100%, they will really try and squeeze until they cannot work anymore. Then they give up. Then that's when you really see these symptoms. So that is why it is very good, as we're going to talk about management and prevention. That is why it is very good to prevent, but also to regularly check our kidney function to make sure that if it happens, it is caught early, because it can be caught early from the hospital, from the things that we check, as we shall explain, rather than you waiting to see the symptoms that I'm going to talk about. So the kidneys help us to filter blood and put out excess water. So if they are not putting out the excess water, this water will be retained. And when this water is retained within the body, it looks for where to go. It doesn't stay inside the vessels. It starts to seep out of the vessels, and it goes under the skin. And so you will start having what we call body swelling. It may start from the legs, especially when you're seated, and maybe as you sleep and raise your legs, you wake up when the legs are okay, and maybe when you wake up you find it's your face that is swollen. So we call it body swelling, and eventually you will swell all over. The tummy will be swollen, the water can collect in the lungs. So most times when I'm seeing my patients, they even know how to check themselves. You get this thumb and press on against your leg, and it leaves sort of a pit or a dip. So that is really it shows that you have excess water or water that has accumulated under your skin. So that we call body swelling, and it's because the kidneys are not putting out enough water. And so because the kidneys are not putting out enough water, also the other thing you'll notice is that actually your urine amount has reduced. So either, we don't count how many times we go to pee, but usually you know that on average, because every time you feel like peeing, you go and pee, but on average you're peeing 3 times maybe a day, 4 times maybe twice at night, depending on the weather and how much you drank. But if you start noticing that the whole of today I didn't go to pee, or I actually went to pee but I peed very little, I have only gone once, so that's what the patients will start to experience. They will actually start realizing that, but it can be as bad as not peeing at all. A day goes by and there is no urine at all that has been passed. And as you can imagine, for some of our patients, like we talked about, those that get acute kidney injury, when they are very sick in hospital, sometimes we put a tube that helps them to pass the urine. And so the attendants will tell you, they put this tube yesterday, but no urine has come out at all. So it can be as bad as that. So either the urine will reduce in amount and someone will still pee, or they will not pee anything at all. So that's the other thing. So if you notice that your volume is reducing, if you notice that your urine color has changed, so sometimes the color may change because we didn't drink and we are dehydrated, we didn't drink enough. But if you start passing blood in urine, so you really see it as blood, or sometimes you may see the urine becoming darker, like very concentrated tea, or as Coca-Cola soda. So if you see that color of urine, please go to hospital. That is a sign that your kidneys are not working well, and it is a sign that you have blood in urine. Then the other thing is, you may see urine when you pee. Your urine may form a lot of froth or foam. like when you wash, when you get omo and put it in water and do this and start and get that froth. So normally when we pass urine, the urine should be nicely, maybe light yellow, or if you drank a lot, almost like water. But if you're passing urine and especially if you're using a toilet, or maybe it's at night and you're passing urine in a bucket or a basin, and it really makes a lot of foam, like you put omo in your urine, please go to hospital. It is a sign that you're passing things in urine that are not supposed to be passed. If your urine, sometimes you may ask yourself, how about if my urine smells a lot? So most times the urine will smell if maybe you have an infection, but also if you're taking some drugs that are going out in urine. So yeah, it is something you may worry about, but if you're taking some drugs, once the drugs go, once you finish your drugs, it will pass. But if your urine amount is little, if you're passing urine that is having blood or Coca-Cola colored or tea colored, and if it is making froth, a lot of froth, go to hospital. That's about urine. Then if you see yourself swelling, the legs, the face, or the whole body, go to hospital. Then the other things you may not see. Remember, we said kidneys make blood. So as you get kidney disease, the amount of your blood is going to reduce. You may not know that you don't have enough blood, but you'll start having symptoms of having less blood, feeling tired very easily, feeling that your heart is trying to pump the little blood that you have. So you have what we call palpitation. So normally our heart pumps and we don't feel it. But if you start feeling like you've run when you were just walking, so that is a sign that maybe your blood is really struggling to pump the little blood you have around. You find you're maybe 30 years old, but you're walking like an old man, because if you walk very fast, you have to stop to catch your breath. You're getting tired very easily. You find maybe sometimes, if it is worse, you feel dizzy. When you stand up or you try to do some work, you feel dizzy because the blood that is going to the brain is not enough. So that's another thing. Then your blood pressure will go high. Remember, we said kidneys control blood pressure. So if your kidneys are not working well, your blood pressure will go high. But remember also, for blood pressure, you won't feel anything. By the time you feel, oh, I have headache, or my heart has a problem, it is when your blood pressure is really very high, like in 200s. So also the pressure is another silent killer. It rises slowly. So but your blood pressure will go high. So if you go to hospital, they may tell you, your blood pressure is high. Then the other thing, we said kidneys balance minerals or salts. So those things will not be balanced. Unfortunately, you will not feel it again. By the time you feel it, it's maybe because the minerals have really been out of balance, that your bones are now affected, and so you have bone pains. Your minerals have been out of balance, that your pressure is bad, or your heart is not working well. So really, the things that you will see are those that I mentioned. And then remember, we talked about kidneys taking out the waste products. So if your waste products accumulate, I like saying this, that imagine if you lived in one room and you peel from that room, you cook from that room, you pee in that room, and then you don't clean it. Because that is what is happening to your body if your kidneys are not filtering blood and taking out the waste products. So it means that the waste products of chafu, of ulofa, it is all staying in blood. And remember, your body is supposed to be working in that environment, but now the wastes have not been removed. So what will happen? You will start feeling weak, because your body is not functioning as it should in that dirty environment. You'll start feeling weak, you'll start feeling like you don't want to eat, you start losing appetite, you feel like you want to vomit, or you may actually vomit. And then that waste, if it is not removed, it will continue to affect the rest of the body, including the brain. So you start failing to concentrate, you start failing to get enough sleep. And then for patients where it gets worse, they actually may get confused. So sometimes patients will come to hospital and the attendants are bringing them because, the patient has gone mad. They are confused, they are talkative, but it may actually be kidney disease that is making them do that. So they get confused, they become talkative, they become restless, and actually if they are not attended to, they go into a coma and they can die. So yes, kidney disease kills. So those are really the symptoms and signs, or the things that you should look out for. Or if you saw someone who is having lower leg body swelling and they are weak and they can't eat, they are vomiting and they are saying they have bewitched me, I'm going to the witch doctor. tell them to come to the real doctor. It may be kidney disease, it may be something else. Now, this is the last disclaimer I am making on the symptoms. The first was that it is a silent killer. These things usually come when 70% of your kidney function is gone. The second is that these things can come from something else. It could be your heart. So if you see someone that is like that, it may not really be the kidney, it may be something else. But like we said, when the heart fails, the kidney fails. When the liver fails, so anyways, they will need hospital. But those are really some of the things that can show us that you may have kidney disease. So in an event that you have kidney disease, what do we do for you? Is there a treatment, or does it mean that you're going to die? And that's the next part that we are going to talk about, and Dr. Rose is going to try and summarize that for us.
Thank you very much, Dr. Kansime. Just also to add that some people might actually not have any symptoms at all.
Yes.
And then you do the tests, and there you are. So when we notice all these things, maybe you come to hospital, you tell us your story, we examine you, we find whatever we are finding. As doctors, we need to do some kind of tests, okay? So there are a few tests that we do, and these are actually available in our hospital, as you get to know eventually. We like to start from urine. I always tell my students that urine is always the best place to start, because in urine, I will tell whether there are any abnormal things that are there that shouldn't be there. I will be able to see the color even without looking, deep into other things. The patient themselves will also tell you about the volume of the urine. But within the urine anyway, there's a lot that we can do. So it's always a good place to start. So you get a urine checked. We also do blood tests, and these blood tests we generally call them kidney function tests, but we're looking for some things, and within some of these things we're actually measuring some of the toxins that we think should be excreted by your kidneys. So we expect them to be within a certain amount of limits, okay? So we do that. We also measure the different salts in your body. These we know are also regulated by the kidneys. So if we find them out of range, we shall be able to tell that this is part of the kidney failure. We also do a blood test that I think everybody knows about, called a full blood count. On there, we shall be able to see if, number one, maybe infection is the cause of the kidney, but particularly, we're looking at blood levels. If you have anemia or low blood levels, that can also be a sign of your kidney function not being adequate. The other tests that we do also include imaging. Imaging is radiology, or doing an ultrasound scan, because we know what the normal kidney looks like on the scan. We also know the size of this, so that the radiology people will help us and measure the sizes of the kidneys, tell us whether they are reduced or shrunken, or whether it's a big kidney. But also the scan will be able to tell you whether the structure of the kidney is normal. We already said it's supposed to be a nice bean-shaped structure that has certain parts that we look at and should be looking normal. If there is a mass or an abnormal growth or an abnormal swelling or multiple other different things within the kidneys, even the scans can be able to tell us. The scan will also be able to tell us whether urine is flowing out normally, and there are different types of scans actually that we can do. We also do investigations that sometimes involve taking a little piece of the kidney, which we call a biopsy, and here we are particularly interested in studying the structure, like the internal structure of the kidney, especially the sieve, to see if there is a destruction of that sieve, and maybe that is the reason why there is blood and protein in your urine. Some of the other investigations that we do are very specific, and we do these when we're looking for particular causes. But for us, generally, we know that when we see a patient, we can do, what I have said, some urine tests, some blood tests, and also some radiology tests, okay?
Yeah. So maybe in addition to those tests, if we are trying to say, is your kidney disease secondary to hepatitis, so we shall look for those things: hepatitis, HIV, syphilis. So yeah, that's really what we do. So if you have kidney disease, what do we do for you? If you come in hospital, or for some of you, maybe you may get a diagnosis from Chisoro, from wherever, and they send you to Mbarara. So number one is to tell you that actually, like, we are introducing ourselves, we are kidney specialists, and we are here in Mbarara, so you don't have to go to Kampala, maybe, unless if we send you for one reason or another. So remember, we talked about acute and chronic, so let's talk about acute. If you get acute kidney injury, as we call it. So I know for most times when you say kidney disease, for some people that may have experienced it, or what you have heard is that you have to go on a machine and then they have to charge you a lot of money. So that's partly true, but not for everyone. So kidney disease occurs in stages. So if it is a stage that needs the machine, yes, we shall tell you about the machine. But usually the early stages may not need the machine, both for acute kidney injury and chronic kidney disease. So that's why we emphasize on coming to hospital early, or what we call like the things that we've talked about: hypertension, diabetes, if you're HIV positive, if you have hepatitis. Keep checking your kidneys to make sure that, you know, if you've got kidney disease, you catch it early and then you get treatment for it, and maybe you may not need the machine. But so if you're in hospital, maybe malaria, infection, or whatever, and you get an acute kidney injury, we give you treatment when it is still early. We give you treatment and do some things to make sure that your kidney disease or your kidney injury does not progress to the stage where you need the machine. And like Dr. Rose said, sometimes it's medications that we are using to treat some drug, some disease, so we may stop that medication and switch it to another, or we may adjust the dose. So we do lots of things to make sure that you don't end up needing imagine if someone was dehydrated from diarrhea, vomiting, or you got an accident, we give you fluids, we give you blood to restore the flow of blood to the kidneys so that the injury can be arrested. But so if the worst comes to the worst and you reach a stage where you need the machine, the reason we are seated here and you're seeing machines behind us, we are going to briefly tell you about this machine. That is actually the machine where we put you to. For this machine will do part of the work of your kidney, especially of removing excess water, removing the excess wastes, so that as we remove those, we restore you back to normal. So with acute kidney injury, because sometimes you may have heard of patients who even went onto the machine and then got fine, got better. So that is acute kidney injury, because it happens suddenly. If we recognize, or you go to hospital immediately, we recognize that this happened, we recognize that you need a machine, we put you on the machine, and then as we clear out the wastes that have accumulated in those few days and few weeks that have accumulated, your kidney function can be regained, or your kidney can heal, or your kidney can recover. And we have very many patients that have recovered, mothers who are giving birth, children who had malaria, some people are involved in road traffic accidents, and you recover completely and your kidney function becomes normal once again, and you no longer need the machine. On the other hand, if it is chronic kidney injury, chronic kidney disease, we emphasize on catching it early. Because my job and Dr. Muhindo's Rose's job, when you have chronic kidney disease, when it has happened, we cannot reverse it, and this is the reason. I believe all of us, if you look at your body, you have a scar, and sometimes maybe this scar came long time ago, 20 years, 10 years. Someone here is looking at their body to see if they have a scar. So if you've been burnt or if something cut you, so those scars do not heal, though they do not disappear. So the wound healed and left a scar. So in chronic kidney disease, irrespective of whatever has caused it, that's what happens. You get scars in your kidneys, and those scars are not going to disappear. And those scars are replacing the sieve. So wherever there should be a sieve working, there is now a scar, and it's not sieving, definitely. So that is why wherever your kidney function reduces, it cannot reverse, it cannot go back, because that scar, we cannot take it out. So that's why we want to get you early, before you form a lot of scars that your kidneys are not working at all. And then when we get you early, my job is to stop formation of those scars, or to make sure that they are forming very slowly at a very slow rate, so that your kidney function can sustain you for some time without needing the machine. Because, so how do we do that? If you have high blood pressure, we make sure we control it. If you have diabetes, we make sure we control it. If you have other things, hepatitis and needs treatment, liver disease, heart disease, or heart failure, so you take drugs for those things, and then we give you a few things to help your kidney, but they are not healing the scars. That's what I really want you to get. And so, unfortunately, if you reach a stage where you need the machine, there are two things. It means that you need the machine, or you need what we call dialysis. So dialysis is where we put you on the machine, and this machine cleans your blood and removes the waste products for you and removes the excess water for you. Or at that time, it's also a time when you need a new kidney. You may have had patients, or you may know someone who went to India or South Africa or Kenya and got a new kidney from a relative, what we call transplant. Remember, we said we have two kidneys, so someone can actually give you one kidney and remain with one, and that one kidney will work perfectly well, because as Dr. Rose was saying, when one kidney is affected, the other one takes over for it. So that's how God in his wisdom, that's how he created us. So we want you to come. So if you're a patient out there, if you're someone out there and you have high blood pressure, you may not have any pain, please take your medicines. If you're someone out there and you've been told that your sugar is high, if they've given you injections, it may be painful to do the injections, but please give yourself those injections, because you're not just reducing your sugar, but you're saving a lot of your body parts, including your kidneys, including your feet, because if you get diabetic foot, they will amputate them, so you're saving yourself a lot. So when you come onto the machine, unfortunately, there are things it will not do. The machine will not give you blood. The machine will not control your blood pressure. The machine will not give you some minerals that you may be lacking because of the kidneys. So the machine can also do so much. So the machine ideally is a bridge. Coming onto the machine, it should be a bridge that is taking you, that you're looking at at transplant, getting a new kidney, because that is the permanent solution for your kidney disease or your kidney failure. Now at that stage, you've reached kidney failure already. So in Imarara here, as we summarize, in Imarara here, as you can see, I know recently, a few months ago, there was a headline that ran in one of the famous papers that in Uganda we have only 3 machines for dialysis. That's not true. And though most dialysis units are in Kampala, Mulago, Chirudu, and then most of the private places in Kampala, in Marara here at the Regional Referral Hospital, that's where we are seated right now, we have a unit that has 3 machines that look like this. So this is one of them, one is over there, and another is over there. So this is the machine. And in this machine, so we put, we connect things, and those things that we connect are the ones that are really working. One part acts as a kidney, the other parts act as tubes that bring blood from you to the machine to be cleaned, and then the other part of the tube brings the blood back to you after it has been cleaned, and it goes through this several times to clean the blood. But as you can imagine, you don't go through this machine once and the blood is clean for forever, because we are passing urine every day, so many times a day, meaning that our kidneys are working 24/7. So if you're coming on this machine, let's say today is Thursday, so let's say you come onto this machine on Thursday, you're going to leave this machine after 2 hours, 3 hours, 4 hours, when your blood is relatively clean of waste products and the excess water has been removed. But when you go home and you drink and you eat, you're going to accumulate more waste. So it means that you have to keep coming to this machine regularly. So actually you're supposed to come to this machine if you have chronic kidney failure 3 times a week. So, and these 3 times a week unfortunately cannot be today, tomorrow, and the next day, because you go, you accumulate the wastes, you come, we remove. then you have to go accumulate the wastes again, come we remove, go accumulate the wastes again, come we remove. So you can imagine if you're living in Tsoro, it means you have to come on Monday, go back to Tsoro, come back on Wednesday, go back to Tsoro, and come back on Friday or Saturday. So it is the part of treatment that sustains people with kidney failure, but it is also very costly. And the cost is not just in terms of transport, as we are saying, if you had to come from Tsoro, but it is also unfortunate that it is something that you have to pay for, because as you can imagine, it is expensive, the things that we use, and it is not absolutely free. It is some cost that is attached. So even if you were who, this is where if you must go on this machine, you really have to pay some money. If you're a patient and you come to hospital, we would explain those to you. So it is not like Panadol, which we shall say, oh, we've written, go to the pharmacy and get this. You would have to pay, but the service at least is available. And also maybe here at Marara Hospital, we also have a day when we have a clinic where we see patients with renal disease. And in this clinic is every Monday at 10. But then do not walk from home and come to this clinic. We shall not see you. So if you really think that you want to know how your kidney is functioning, go to any nearby hospital. If you're in Tsoro, Kabale, Fort Portal, wherever you're watching us from, Masaka, go to a nearby clinic, go to a nearby hospital, let them do those tests for you that Dr. Rose was talking about. They can check your urine, they can do a scan for you, they can do blood tests for you, and if the doctor thinks that you have a problem with your kidney, they would send you to us. Because you can imagine if all of you walked into that clinic and I am there alone, I will not be able to see all of you. So we really see those that have come to us because someone has sent them because they think they have a kidney problem. So please feel free to go anywhere near you. If you're a patient with diabetes, if you're a patient with high blood pressure, HIV, make sure you ask your doctors where you get your medicine from to check your kidney function, and they will let you know how your kidneys are. And if they think there is a problem, they will send you to us, and we shall gladly receive you and be able to offer you the help that we can give you. So as you hear me emphasize, prevention and early diagnosis, because when we diagnose early, we can do something. When we diagnose late, we have to put you on the machine or tell you to get a new kidney. So if you're out there, and also if you're a health worker and you're watching this program, please, if you're taking care of patients with those chronic illnesses, diabetes, hypertension, heart failure, liver disease, HIV, there are very many patients with HIV, and they are receiving treatments even from low health centers as health center 3s and health center 4s. So if you're the health worker at that level, and we know in Uganda at those levels sometimes we cannot do some of these tests, once in a while send your patient somewhere where they can do those tests, check their urine, do their blood pressure, because if you have HIV and high blood pressure, then you're much more in danger than someone who has only one of those, because if you have diabetes and high blood pressure at the same time, you're much more in danger of getting kidney disease than someone who has one of those. So even us as patients, even us as attendants of those patients, or as healthcare workers who are taking care of these patients, let us look out for those risk factors. If we have someone who already has hypertension, let's maybe once a year check to make sure their sugar is okay, they don't have HIV. If we have patients that are having HIV, let's be sure that the drugs that they are taking are not affecting their kidneys. So we just have, it is a community, or it is a group effort. One person cannot do it on their own, because if we have a patient who has hypertension and they are genuinely taking their drugs, or high blood pressure and they are genuinely taking their drugs, but we never check to see what their kidney function is, then it will be us that have failed them. Dr. Rose Akatalekeka.
Thank you very much, Dr. Kansime. I think she has given us a very, very good overview of the treatment. I just want to emphasize that the treatment is available at our regional referral hospital. In the past, everything was in Kampala, but I'm glad to say, and very proud to say, that at least on the southwestern part of Uganda, we are able to offer these services. We do receive patients even from the neighboring countries, but we help everybody. We get patients from the districts of Kabale, Kisoro, Fort Portal, Kasese, even Masaka. We get patients from there. All those actually proceed to Kampala. So we are very happy that we've been able to do this program. Mine is just really going to be an appreciation. I really want to thank you very much, our viewers. You've been a very good audience. I want to thank Acute TV for giving us this opportunity to educate our community and just to refresh our memories and create awareness. As we say, this is Kidney Month, so we are creating awareness to improve kidney care of kidney patients, and everybody needs to know that we are all potential patients. Myself, I can be a kidney patient. Dr. Kansime can be a kidney patient, touch wood, God forbid. Yes, so we also want to thank Bara University of Science and Technology and Makerere, where Dr. Kansime trained. We really want to thank the International Society of Nephrology for having given us the opportunity, and we've been able to train as specialists. Uganda Kidney Foundation, that is who we are. We have been able to do what we are doing. We are reaching out to various people, various communities as Uganda Kidney Foundation, and encouraging people to actually join. We will remind us that Uganda Kidney Foundation is not only for specialist doctors and nurses, but we also have patients, we have well-wishers, people just that who are interested in knowing about kidneys or supporting anyone with kidney disease. Thank you very much, Bara University. Thank you, Bara Regional Referral Hospital, for giving us the space. We needed to also say that on top of the 3 machines that we have been able to receive a donation of 5 extra machines from a collaboration that we have with the University of Bari in Italy, and we are hoping to expand our services and get a much bigger unit that can serve at least the southwestern region of Uganda. I think that's... Have I forgotten to thank anyone? Thank you very much, Dr. Kansime. Yes, thank you very much, Dr. Rose Muhindo, for being
all right.
Yes, okay. Again, we'll say that we are available. We run clinics, yes, on Monday, but the dialysis unit is available all the time, anytime, for whoever needs it. Kidney transplants are not available in Uganda. Kidney care is very expensive. We shall re-emphasize prevention. Please get yourself checked. Do not take medication that is not prescribed. Do not assume that kidney disease is far from you. The kidney patient is actually near you. And we also know that because the care is very, very expensive, we encourage ourselves to regularly check, detect it early, and get the necessary treatment. We are available various numbers. Dr. Kansime gave us her number last time. Now it is my turn. My number is 0772 406 337, and those who prefer an Airtel number, it's 0703 00 8972 0703 00 8972.
Thank you very much, Dr. Muhindo. If you're watching this and you're a policymaker, I have a special word for you. If you have the ear of your MP or you have the ear of the president himself, so we are grappling with all this and saying kidney care is expensive. Yes, it is worldwide, but here in particular, and in Bara in particular, because we really do not have I won't say we don't have government help, but we need more. We have, because these machines came from the government, but we need more. As you can imagine, we have lots of patients who cannot afford dialysis because it is way expensive. So we need more help in accessing the machines, in training the people. You can imagine if Dr. Kansime and Dr. Muhindo are supposed to treat all the patients south of south of the equator, all the way from Marara, Kisoro, Fort Portal, Hoiman, Masindi, will surely not manage. So we need people to be trained so that at least each regional referral hospital can have someone that can take care of your kidneys, so you don't have to travel from Bundubujo to Fort Portal, but do not continue to Marara. So we still need that help. and but we know that together, and all of us together, we can. So feel free to post your questions, we shall respond to them. And once again, thank you very much, AET, for the opportunity, and we are also always available to educate the people. Thank you very much. Have a good night.
You're watching AET TV, empowering you.